Dr. Joseph Kanu understands that one way we can honor God is by being as healthy as possible. Dr. Joe believes modern science proves the healing abilities of remedies found in Scripture, and as a practicing chiropractor, blends those biblical truths with cutting-edge technology to enrich his patients' lives physically, emotionally, and spiritually. Welcome to Simple Truths for Healthy Living with Dr. Joseph Kanu. Listen for the next 30 minutes as Dr. Joe shares tips to help you live the healthy life God intends for you. To be a part of the show, call 313-838-1035. That's 313-838-1035. And now your host, Dr. Joe.
Well, welcome to Simple Truths for Healthy Living. This is Dr. Joseph Kanu, broadcasting from Rochester Chiropractic, and we have a wonderful guest with us. I really don't even want to call him a guest anymore. I want to consider him a partner in health, Dr. Jeff Haddad.
Right, a partner in health. I like that.
Hi, Jeff. Man, I'm glad you're here today.
I'm glad to be here.
Yes.
It flies by every week, but I look forward to it, and I've been doing my homework as always.
I see you have been doing your homework.
I have. Well, you put me on a little task.
Yes.
I think we talked about last time. We wanted to cover a certain topic, which was dental fear. I didn't really have to do much research, but I really thought a lot about my experiences, in my career of patients, their fears, and what I've seen either in the chair or even just talking to people of what people are afraid of and why they avoid the dentist. And I'll tell you, I've said this many times in the past, that the three reasons, there are only three reasons that people don't go to the dentist, are time, fear, and money. Okay?
Time, fear, and money.
I can't think of any others.
Big, yeah.
And the time and the money, I can't help patients with, unfortunately. That is on them. But the fear, my goal for today is for us to alleviate those fears, because a lot of them are just, the human brain is a dangerous thing.
Yeah.
You start thinking about things and you put things in your brain and they're unrealistic. And plus, people who have avoided the dentist for as long as maybe they have, they don't realize the changes. We've talked in the past about the improvements in dentistry.
Sure.
And I'll tell you, the number one reason that people fear the dentist is a traumatic incident in their childhood. Now, if we're talking about
30 years ago,
20 years ago, 40 years ago, we're talking night and day. We might as well be talking about a different profession. So my goal and our goal tonight is to show everybody how much things have improved and just welcome people back to the dentist, because the longer they stay away, the bigger problems are going to happen.
The bigger the problems, yeah. Well, great, Jeff. Well, why don't we start with a reading?
Great.
And that's what we're going to cover tonight,
Perfect.
Dental fears. So this is out of Hebrews chapter 5, verse 11. And this is about renewal, spiritual renewal. You're talking about dental renewal?
Yes.
Spiritual
I like
renewal, okay? About this we have much to say, and it is difficult to explain, for you have become sluggish in hearing. Although you should be teachers by this time, you need to have someone teach you again the basic elements of the utterances of God. You need milk, not solid food. Everyone who lives on milk lacks experience of the word of righteousness, for he is a child. But solid food is for the mature, for those who have faculties are trained by practice to discern good and evil. So, childhood, you were talking about dentistry, things, how you did things back when you were a kid is not how you practice now.
No.
I love you said it's a totally different profession.
It truly is.
Right? And why don't people go, I always use the dental analogy in my office that just as everyone goes to the dentist twice a year,
right,
before you're in pain, don't wait till you're in pain, because then when the dentist barely touches you, you're screaming out.
Right.
Come in before you have pain, before it's a problem. Go to the dentist twice. But only 8% of the people use chiropractic, and we usually see people when they're hurting pretty bad.
Right.
Hey, if it ain't broke, don't fix. They don't come in. They wait till they're dying, till they're crawling in.
Mm-hmm.
So what percentage of the people we serve about 8%.
Well, I think it's interesting. I mean, you just made the assumption, which a lot of people do, that everybody goes to the dentist, right?
Sure. Well, at least I would say 90% of the people should go to the dentist.
I would be thrilled with that. Do you understand that only 50% of the population go to the dentist regularly?
Wow.
Okay?
That is way lower than I think.
And that's just regularly. I mean, that's actually skewed a little bit because some people, they have a toothache, they'll go here and there and there. But it's as much of a problem in dentistry. Well, maybe not as bad as chiropractic, but it's the same idea. And the same thing that keeps people away from the dentist, it's a cyclical thing. They stay away. Things get worse before we can fix them. They start to hurt, and then they have another bad experience at the dentist.
And another bad experience.
And then
because they've waited too long.
Right, and so it reinforces their fears.
The expense and the pain.
Everything gets more expensive and more painful if you wait.
Mm-hmm.
And so it is something that, again, I appreciate people's fears. I want everybody to know and hear me that I'm very compassionate. I'm very empathetic. I do not like being in the chair, okay? I wouldn't say I'm afraid of being in the chair, obviously, but I do not like it, okay? And I used to
probably because you were a kid.
I had so much. Oh my Lord! I had so much dental work done, and it was just. I mean, I was just. It was terrible. The education was bad back then.
Yes.
It was just a different time, And now, I'm paying for it. But the fact is, I know, obviously, being in the profession, how much it's changed. And I'll tell you, at least in our office, and I know a lot of other dentists that I know, we use some just amazing amenities and tricks and instruments to make things easier for patients, less or non-painful at all, faster, which less time in the chair is better,
Sure.
And it's just, I want people, again, at the end of the show today, I'm hoping that people are going to say, wow, I can't believe they do that at the dental office now. I mean, it's, the number one fear is fear of pain, okay?
Mm-hmm. Well, starting with the shot. I don't want a shot. I hate needles.
You got it. You got it. And so...
Jeff, I've had my patients, we come to see you.
Right.
Can't even, it's like a tiny little pin, not even a pin prick.
Right.
Not even that. A lot of times, my kids didn't even know.
They were getting the injections.
Got the injections.
Yep.
Didn't even, when I'm sitting there watching, it was like.
Ignorance is bliss,
like,
Joe.
when is he giving me the shot? It's like, it's done.
Right.
It's over.
Right.
Like, what are you talking about? Did not even feel. Now, how do you explain that? So you're a master at giving initial injection.
Well, I'll tell you. Well, I appreciate the word master. I mean, that's I don't know. I'll accept a compliment always, but
okay.
I'll tell you. I remember like it was yesterday. One of my mentors in dental school. He said, "If you want to be a successful dentist, you know what you need to do." And I'm thinking about all these things, right?
Yeah.
Give a good shot. That's all he said. And I said, "Really? That's all you need to do." And I'll tell you, I took that to heart. And you never perfect anything, but I'm going to tell you, I have found a way that I use, that I get compliments daily on, wow, I didn't even feel that. That's amazing. That's the best shot I've ever had. I can't believe,
Or they didn't even feel it.
Or they didn't even feel it.
Like my kids didn't even feel it.
I tell parents, specifically, do not ever tell your child that they're getting a shot. They will not know when I'm done. Guaranteed. And the reason is two things. I'm not going to toot my own horn.
So they didn't even know most of your patients don't even know they got the shot.
Well, children. I mean, obviously, adults know what I'm doing, but children have no idea. I'm like, listen, let me know if I push a little too hard here. Oh, you're pushing too hard. I'm like, okay. Is that okay? Yeah, that's fine. And then you're done. They have no idea. It's beautiful. And I do two things. One is, again, I consider it a very slow and gentle technique, okay? But it's not all me.
The needle must be very...
I use a smaller needle than most. I'm glad I wasn't even thinking about that. I do. I use a smaller needle than most. And then I use a topical cream that is amazingly strong. I mean, it's very expensive, but I don't care. I want my patients to have the best. And it's plastic surgeons use this stuff, okay? And so this is very, very safe and very, very effective. And it makes that whole process a no-brainer.
So for the people who are afraid of getting a shot, you use a topical to numb it first.
A very strong topical.
Just a cream.
Yep. Put it on there. I actually have it put it on there for several minutes before I even come into the room. My assistant puts it on. I don't mess around, Joe. I do not want anybody to have a bad experience. That's not how I base my reputation.
Your experiences as a kid.
No question about it. No question about it. I mean, I want people to have an experience and say, wow, that is nothing like I've ever had in another dental office. That's one of the best compliments I could ever have. Well, my other dental office didn't do that. Perfect. I am doing something right then, you know, and it's a good thing to hear.
So that's interesting. So you do the topical, then you give the shot. Can't even feel the shot.
Correct. And let's go to the next level with the fear of pain. If for whatever reason I give anesthetic, and let's say you're still feeling something, please, if I don't see a hand raise, I don't know that it's bothering you, okay?
Okay.
You let me know. I'm going to stop right away, and we'll give you a little bit more anesthetic. Some people need more than others. I err to the side of more for everybody because, again, I want somebody to be able to lay there and just relax to a point where, you know, not only are they relaxing, I don't want to see the white knuckles. I want them relaxing. We actually give them an iPod with music so that it drowns that out. We'll give them a nice blanket for a little comfort and warmth. Mm-hmm. We have massage chairs that take their mind off everything.
While you're working on them.
While I'm working on them. I want them to just forget about the fact that I am doing anything in their mouth. And I'm going to tell you, these things work. Having music, sometimes music that even the patient will bring in or request, it's a beautiful thing. It drowns out the noise of the drill, drowns out the outside environment. You literally kind of forget where you're at. It's a great thing. It really is. So, you know, those are the things those are the two top things of fear: fear of pain and fear of the injections. And you know what the third one is? I bet you probably wouldn't guess because a lot of people wouldn't think this, but it's embarrassment.
Embarrassment. Oh, my mouth is such a train wreck.
Especially people who have been avoiding the dentist.
Wow.
They're afraid to be judged. They're afraid to come back because, I've let myself go this
He's going to yell at me.
Yeah, exactly. And I'm going to tell you, everybody, please listen to me. Listen to my words. I can promise you, I can speak for myself, and I feel comfortable speaking for the majority of dentists. You will never be judged. You are going to be welcomed back to the dentist, and I promise you, I have seen worse mouths than yours, and I guarantee that. I have yet to have somebody walk in and me say, oh, my Lord, what do I do with this? It doesn't happen, okay? I've seen some things that you'll never – I won't even get into, you know, details with, but please know that it's never too late, and your dentist is going to embrace you, and they're going to welcome you, and they're going to educate you, and they're going to get you back on track if you allow them to. Please don't wait till it hurts. If it hurts, you're going to have another bad experience where you're already in pain, and then we've got to numb you up, and our anesthetic isn't working as well because you've got a big infection, and now here you are.
A big infection.
The infection does not let anesthetic work as well. And so there are just you're unfortunately shooting yourself in the foot by waiting because it gets worse. It gets more expensive, gets more painful, and please avoid that. And remember that, you know, and we'll have to take it to the next level actually on some of this because there's certain people who are listening right now. I'm like, great, that's all great. I'm still scared to death. Physically and mentally, I'm physically afraid of even coming to the dentist. And I've got some ideas as far as that goes that we use for other patients that truly would avoid the dentist even if I promise them they wouldn't feel it, okay? There's a thing called sleep dentistry that we practice in our office, and, you know, we have information on our website, RochesterAdvancedDentistry.com. Go there. There are tricks that we use to put you at ease, some certain medications, certain, again, little tricks of the trade that we do that will put you at ease. So you need to,
well, it's so vital, too, for your health. You have to think of it's not just cosmetics, but this is killing us.
Correct.
The Lord's people suffer for lack of knowledge.
I agree.
Hey, Doc, I would like to go cover that sleep dentistry and some of these other tools of the trade that you're using after this short break.
That sounds great. We will do that.
All right.
Are you self-conscious when smiling for pictures? Do you ever cover your mouth when you laugh to hide your teeth? Do you want to regain that healthy, youthful smile you used to have? Maybe it's time to finally invest in yourself and transform your teeth into the beautiful smile you've always wanted. At Rochester Advanced Dentistry, you could have the smile of your dreams, a confident and healthy smile. With the latest techniques in porcelain veneers and dental implants, Rochester Advanced Dentistry will change your life. For more information, visit RochesterAdvancedDentistry.com or call Rochester Advanced Dentistry at 248-656-2020. 248-656-2020. You're listening to Simple Truths for Healthy Living with Dr. Joseph Kanu of Rochester Chiropractic Clinic. Get ready to call. Get ready to learn. Get ready to live, feel, and be better with Dr. Joe.
Well, welcome back to the show. This is Dr. Joseph Kanu and
Dr. Jeffrey Haddad.
Jeff Haddad, and we are talking about dentistry today, and Jeff is covering the fears of the dentist. Only 50% of the population goes to the dentist, which is staggering to me because it's killing us. Not, having infections, mercury amalgam fillings, the gum disease, periodontal disease, all that. So we really have, if you know somebody who is having dental fears, you might want to recommend they see Dr. Jeff, because I'm going to tell you, not the shot doesn't even, and Jeff, we can do some consultations first as well.
Well,
right?
no, that's a good point. I've actually had patients in the past, whether it be for fear, whether it be because they just wanted to see if they like my personality, they literally will set up a consultation where I don't even look in their mouths. We sit, we talk about goals, goals that I would have for them as a patient. That's
pretty nice to do at first. So it's not like the first visit they're in the chair getting drilled on.
No question about it. Listen, I need a chance to build trust, and I do, but I need that opportunity. But some people are hesitant to do that, and I respect that. But if you are fearful of the dentist, any dentist, see if you can come in and maybe have a tour of the office, speak with a doctor, meet them, because right away they may put you at ease. And hearing, again, whether it's our show tonight or hearing what they have to offer you as far as relaxation techniques and things like that, that could be the key to get you back in the dental chair and feel good about it.
Absolutely.
So we briefly talked about the sleep dentistry.
Well, I want to hear about this.
Yeah, well, a lot of people say, well, can I be put to sleep? And I mean, it's almost like a joke. And can you just put me to sleep, doc, and do whatever? Knock me out,
hit
right?
Me in the head with a mallet.
You got it. And
wake me up
we only do that rarely. No, no, we don't. We don't use mallets. But what we do use, and listen, if it's a really severe dentistry, and like a special needs child or something like that, we'll do actually IV sedation. But in my opinion, that's overkill. You're putting somebody under, truly under general anesthesia, and it's not necessary. I'll give you an example. We use a lot of oral and especially oral and even nitrous oxide type sedatives. Okay, I will talk about oral sedatives first, like a Xanax or a Valium. My mother, I literally rebuilt her mouth. Okay, and she's got the most beautiful smile you've ever seen. And she doesn't remember anything.
Your mom?
My mother.
Your own mother?
My own mother. She said, Jeff, I don't want to know. I don't know what you're doing. So we gave her a couple Valium. She was awake, but she was,
So she was having a real fear of dentistry?
A lot. And I mean, we had to do a lot of work for her.
So she must have had a bad experience as a kid, too?
A lot. And I was very self-conscious of her teeth. And again, just a different era.
Yeah. Mm-hmm,
and so when I said, Mom, don't worry, we're going to keep you comfortable. We're going to take care of everything. These medications have kind of an amnesic effect too. So you're awake, but you're not really remembering everything. In addition to the fact, it makes the time go by so much faster. I could have you in the chair for 2 hours, and it'll feel like 15 minutes, and it's a nice thing. Some people may not believe in drugs. I respect that, but if you're truly that fearful, these are very safe medications,
right.
Short acting, which is very nice, gets out of your system fast, and when you're done, you really don't realize what happened, but you wake up with your beautiful smile or your new crown or whatever it is that you need, to have taken care of.
Right.
And now you've been reintroduced to the dentist, you had a good experience, and now we build on that. A bunch of good experiences can offset that bad one, okay? And it may take some time, but if you give the dentist an opportunity, he or she can make that happen for you.
Well, I like the point that these medications, like you said, there's a downside to it, but you're using something that's not real severe.
Right.
But the worst downside is not going to the dentist.
I agree.
Right? That's a bigger health risk. So if that's stopping you, and maybe if they have this fear, they can have it the one time, be sedated, right?
Yes.
And then they get over their fears, and then the next time it might not.
No question about it. I'm so glad you brought that up.
Not need to be so as dramatically sedated.
That is usually what happens. I mean, honestly, that's really the majority of people.
Because you're breaking this cycle.
Yeah,
of
you're like,
when you
wow,
go to
that
the
wasn't
dentist,
too bad.
It's painful.
And people try to psych themselves up, and they're like, you know what, I need to be without that. Better living through chemistry, fine, but I want to move on. I want to, build my confidence here and do that to a point where we'll go to that next level, which a lot of people have heard of nitrous oxide as a laughing gas. Okay.
So let's start for the top of the top, for someone who's so fearful they don't want to go. You have this. You put them into a twilight.
Correct.
Twilight. They don't even really,
I would recommend they have a loved one, a friend, drive them there because they're not going to be able to drive back.
Right.
And I would recommend. There's a few out there that are used. I commonly use like a Xanax or a Valium. They work very, very well. Some people have taken Valium before and they've done well with it, so I'll say, all right, we'll take that again. And same thing with Xanax, just kind of a choice. I usually prefer Xanax if I have my choice because it's a shorter acting. Gets out of your system faster. And but again, that to the next level, okay, which I think you're asking here, is nitrous. Now, nitrous is the laughing gas. A lot of people think that is pain control too. It's not. A lot of people have had nitrous, like, oh, well, my last dentist, we just used nitrous, and he or she didn't have to give me a shot. Again, that's not true. You probably just don't realize that they gave shots. It has nothing to do with pain control, but it has to do all with relaxation. And letting you just be floating. You just, again, time is, it's like that. You've got an hour appointment, you feel like it's 10 minutes. And it's a very good thing.
Kind of like our show feels to
It
us,
is. It's true. That is true. It flies by. Is there a nitrous tank around here? No. It is. And
so the nitrous is not about pain. It's about getting you to relax.
It's about relaxation. And, it is, here's the nice thing about it, too. I know that there's a lot of health-conscious listeners out there. I know that you feel this way. You do realize people don't, I think they feel like they do this gas and they're not going to be able to drive home. We literally put you on oxygen right at the very end. It's like we were never even there. Nitrous is it's not in you. It's you're breathing it, then we flush you with oxygen and you're done. Okay,
wow.
That feeling's gone.
So that's pretty safe. Then.
Very. It's as safe.
So it's not like you're taking medication in your body, like a pill that makes you very acidic and eating your stomach, even like Motrin or ibuprofen.
Mm-hmm. It's very, very safe. And again, in the dental chair, obviously you've heard of maybe nitrous used recreationally. That is not safe, okay? Yes. But the way that we do it, it's a specific mixture of oxygen and nitrous that is completely safe.
Pretty controlled, and
very
like you said, very short acting, and then you flush it with oxygen.
You got it.
Okay.
You got it.
So what's the next level from there then, Doc?
Well, at that point...
So now you're weaning the patient down.
Correct. We'll always be using...
And they are getting good dental care then.
Oh, no question about it.
That really is the goal for half our population.
We need to get these people dentally stable. The people who avoid the dentist, their time bomb's waiting to go off, okay? Listen, I've ran into my handful of patients that have been very lucky, that have been away from the dentist for, 5 to 10 years, and somehow don't have a cavity. But I'm going to tell you, what they do have is gum disease, and it's not hurting them. But as we've talked about in many other shows, it's a silent killer, and that infection that's happening there, great, you don't have any cavities. Well, your teeth are floating around in bad, gum tissue and bone, and it's just as bad. It just doesn't hurt you. So avoiding the dentist is bad no matter which way you slice it. And you can ask a non-dentist, and they'll tell you the same thing. It's a very important part of your overall health. And you and I have talked at lengths about this. So to avoid the dentist is only doing you harm, whether it be pain or from a health aspect. There's nothing good that's going to come out of that. And so, to answer your question, the next level, all right? And I kind of would put that because people who are under, their, oral sedation and things like that are going to still be having some of these amenities. But my iPods, the music is a beautiful thing. I want to have, if somebody came in and let's say they just didn't like going to the dentist, they didn't like having dental work, but they weren't afraid of it. They just wanted it to be the best experience they could. I'm going to give them their music, which I give everybody. I'm going to put them in my massage chair, which I will do if anybody wants that. I recommend it. Having a blanket on you, as simple as it sounds, not only is for warmth, but just it's a comfort thing. It's a comfort thing, very comforting. My ladies,
it helps you to relax.
No question. And the ladies in my office, I'm going to tell you, I couldn't do what I do without them. They put more patients at ease than I could ever do. It's so impressive. The compliments we get, not only on my dental work, but on how they were treated from my team members. Joe, it makes me so proud of them and my overall practice. It's an amazing thing. Just how compassionate and comforting these ladies are, And I just want people to realize that things have changed all for the better. Dentistry is a different profession than it was when you were a child. And if you truly haven't had a good experience in a long time, and that's what's keeping you, listen to my words and give it a chance. Go to my website, please, rochesteradvanceddentistry.com, or if you would, like a consultation, just to talk about things, maybe even talk about your fears. You may have some specific fears that I could alleviate that we're not even talking about today. And I say, oh, well, we don't do that here. And you say, oh, really? That's what's been keeping me from going to the dentist. Call our office at 248-656-2020. I'm happy to. I've had many patients who have I almost say interviewed me. They want to know if I'm the right person for them.
Right.
It's not just about, if I can help somebody. Maybe you don't want me. There's a lot of dentists out there, and that's a great thing about dentistry. Every dental office is different, okay? I know that I'm proud of my environment. I know that you send a lot of patients to my practice, but we're not the dentist for everybody. But I'm hoping that if you came and you're looking for somebody who's going to take care of you, give you the best possible dental care possible in a comforting and non-stressful environment, we may be the dentist for you.
We might be the one.
So.
Hey, Doc, we've only got a minute left.
Okay.
What about pregnant women? In dentistry?
That's a great question.
Can they get the laughing gas?
No, they cannot. Actually,
okay.
One of my one of my assistants is actually pregnant right now, and no, so nitrous oxide has been known to cause more miscarriages. Yeah, so we do not do that. There's a lot of things in dentistry that we're unsure of with pregnancy, but we don't mess around with, and that's one of them.
Right. But we do know if you have periodontal disease and you're pregnant.
Big problems.
So
while you're pregnant, here's the recommendations. You make sure you keep up on your cleanings. In fact, I recommend an extra one during your pregnancy. And if you need dental work, if you need it, there's certain dental work that you need. Second trimester is the best time to have
Second try.
Unless you can wait till the end of your pregnancy.
Yeah. So, well, that was a great wrap-up, Doc. So if you have fears, there's things you can get over. If you're afraid of needles, you can do this needlelessly.
I mean, as far as the patient knows, yes.
As far as the patient, no needles, and it's so paramount because if you have periodontal disease or infections from fillings,
correct,
it's going to cause major health problems, cause sleep apnea. It's going to basically shorten your life. It's very important to see a dentist regularly, and there's a far vast difference than what it used to be.
There should be nothing keeping you from the dentist
these days. These things can give us bad breath as well.
Oh.
How about we do that for next week, Doc?
That's actually a very good idea. I'll tell you, one of the big problems of bad breath is gum disease, undiagnosed gum disease. So these people who are afraid of the dentist staying away, they have bad breath. They don't know why. It could very well be undiagnosed gum disease. So we will cover that. I like that.
If we can listen to the show on simpletruthsforhealthyliving.com or contact Dr. Haddad at his office, Rochester Advanced Dentistry, 656-2020, and I know you'll be very happy. Have a wonderful night, and remember, in all things that you eat, drink, or do all things to the glory of God. Dr. Jeff will be on next week.
Looking forward to it.
All right. Good night.
You've been listening to Simple Truths for Healthy Living with Dr. Joseph Kanu. If you'd like to talk with Dr. Joe, call 248-656-1011. That's 248-656-1011. And tune in again Monday through Friday from 10:30 to 11 for another edition of Simple Truths for Healthy Living with Dr. Joseph Kanu.
The content on this program is for sharing general information purposes only. It is subject to change with ongoing research. It is not meant to diagnose, treat, prevent, or cure anything. Dr. Kanu encourages you to make your own healthcare decisions based upon your own research and in partnership with a qualified healthcare professional of your choice.